U equals you, it saved my life, and it could save yours, right after this quick message.
When you love who you are and stay true to yourself, you inspire others to do the same. Ask your healthcare provider if Biktarvy is right for you, or visit Biktarvy.com to view the important facts, including important warnings.
Welcome to Plus Talk on Plus Life, where we're about turning positive into a plus. Bruce Richmond, it's a name you may not know, but you certainly know the letters U equals U. Well, Bruce is the man behind that, and he joins me now via Skype. Bruce, can you hear me?
Yes, I can hear you. Can you hear me, Carl?
I can hear you and I can see you. Thank you so much for taking time out of your busy schedule. You are a globe trotter, spreading the U equals U message. So people have heard me talk about this, they've seen it maybe on the subway, they've seen advertisements. You're the man who started it. What is U equals U?
Well, first, thanks for having me, Carl. I really appreciate it. And thanks for all of your work getting this message out all over the world. You've been an incredible ambassador, and it's so much fun to watch you and hear you talk about it everywhere. So U equals U means that a person living with HIV who is on treatment and has an undetectable viral load, and that means that the virus is suppressed so low in the body that it can't be measured by tests. That person not only stays healthy, but they cannot transmit HIV through sex. Undetectable is untransmittable.
And how did this all come about for you? I mean, this has been something that you've been out there tirelessly going around the world for a number of years. Just give us a bit of the backstory about how you discovered this and the science behind it.
Well, I was diagnosed with HIV in 2003, and my doctor told me after a scare when a condom broke in 2012 that, don't worry about it. You can't transmit HIV. It's impossible. You're undetectable. I said, are you kidding me? What are you talking about? This is amazing. And he said, yeah, absolutely. I'll tell any of your partners can come in. You don't have to worry. So, then I started, obviously you look online and I couldn't find anything and except for a couple of research articles. And I started asking around and it seemed that people in positions of influence in the field and very well connected to the medical establishment knew U equals U, and they were maybe telling their patients on a case-by-case basis or telling certain people, but most people didn't know. And it was really mostly the people that are marginalized by the system, who are already left out of the system and aren't privileged enough to have the kind of doctors that I had. So I got really angry. What the hell is going on? We got to get this information out to everyone, not just privileged people like myself. And that's when I brought people together and said, let's do this. And we developed our strategy and then you know the rest.
Yeah, and this is based on science. It is science. This is not sort of a theory or an ideology. This is based on scientific fact. Without sort of getting too scientific so that everyday people like me can understand what you're talking about, just give us a bit of the backup of the evidence that supported this. And how long have people known about this?
Well, the evidence goes back to, really just after the advent of antiretroviral therapy, so the medications that keep us alive. So in the late 1990s, there were studies showing that treatment reduced transmission. But the body of evidence that proves U equals U is really, goes back about 20 years. And recently there were very clear kind of landmark studies that showed there were no transmissions between people with HIV who are undetectable and HIV negative people. There were about 130,000 acts of condomless sex and no transmissions. So what we initially did to clarify that science was bring the top researchers together in the field from Switzerland and the Netherlands and Australia and the UK and the United States, and said to build this consensus that, look, based on all of these studies, all the way back to really the last 20 years, there's never been a case of transmissions, and the evidence is robust, and we've got to clear up mixed messages. This is true. The science is clear, and let's make sure everybody knows it.
Now, so when they do these studies, is sort of everyone and every type included in the study, or is it just gay white men who have sex with men who are sort of being looked at because for the longest time we have been sort of the ones that everyone assumes are really the only people in the world that are affected by HIV. Of course, we know that's not the case at all. In fact, we're just a small part of the global population that makes up those who are either at risk or living with HIV. But when these studies were taking place, who was included in those studies?
As every human. So going back, some of the studies were conducted in different parts of Africa. Some of the studies were in Australia and Europe, Latin America. So really, this is basically people with vaginas and penises, front holes or back holes or whatever, however people want to self-identify their body parts. All kinds of genders and backgrounds were a part of these. So it's it's comprehensive and it applies to everyone.
And again, for those of us living with HIV, it might seem sort of the obvious thing that we go, of course, U equals U, U equals U. For those who aren't living with HIV or who are out there who think HIV doesn't affect them because they don't have a son or a brother who is a gay male, or they don't know somebody who may work in the sex work profession and they think it doesn't touch them. U equals U changes the game, doesn't it?
It changes the game for everyone. It's not only changes the social, sexual, and reproductive lives of people with HIV. We can love, we can have sex, we can have babies now without any fear of transmitting HIV. But it also changes the field, so it reduces people's anxiety associated with testing. So more people will get tested and then get diagnosed with HIV and become healthy and and take their medication and not pass on HIV. So it means that it would be fewer new transmissions and more happy and fulfilled lives for those of us with HIV.
So what about the critics out there, Bruce? Because we do have our critics. One in particular who suggests that the messaging of U equals U is not reaching the community it claims to be saving or empowering. It's rather emboldening folks to weaponize status while creating a hierarchy within HIV. That is to say that, well, guess what? I can get the medicine because I have health insurance and I'm undetectable. You can't, so thus I'm better than you. How do we combat that kind of critique that is out there and sadly, from the research I've done, quite prevalent here in the United States, maybe more so than anywhere else in the world, who has picked up the U equals U message?
Yeah, I think what's really hopeful about the message is that, as activists, when we advocate for access to treatment or care and services like housing, employment, mental health, counseling, all sorts of services for people to help lift people up and empower people of all backgrounds. We used to just say that we need access for the well-being of people with HIV. That's it. And that's a whole bunch of activists just went to Capitol Hill and that was their argument, was we need, all the services and care and treatment for the well. And now you and I care about that, but a lot of policymakers don't care about the well-being of people with HIV, but they care about prevention. So now we can argue we need treatment, care, and services for the well-being of people with HIV and to prevent new transmissions, which will get us closer to ending the epidemic. And so we're seeing this start to change policy, which will help all people living with HIV and lift everyone up. So that argument that we're not helping folks that don't have access to treatment is really backfires. We actually can use this to help people get access to treatment. And in terms of the messaging not reaching people, that people are creating messaging for absolutely every background, for long-term survivors, for transgender women, for sex workers, for young Black and brown men. People are just creating the campaigns to reach their community. So if someone from a particular community is saying this isn't reaching 5-year-olds, create it for 5-year-olds. Go out and do it. Don't complain about it. I think the biggest thing in this field that I've seen, especially in the United States, is it's very easy to be an armchair critic and complain, rather than actually go out and do the work. So if somebody thinks it's not good for a certain community, create the messaging. But we're seeing messaging everywhere. Have you seen from China to the Ukraine to South Africa to Zambia, Nigeria, Vietnam? That's all messaging for all bodies. So it's all happening. It's all out there.
Yeah, and you mentioned a word several times just then, empowering. and uplifting. And I can speak to this on a personal level in the sense that I didn't know about U equals U until my public disclosure of this almost 2 years ago. And it was you, sir, who reached out to me via Twitter and said, hello, I'd never heard of U equals U before. And I've said this before. The message was like somebody gave me the keys to the handcuffs that had been put on me as a 27-year-old man when I heard that I was HIV positive. That was it. The handcuffs went on, and that was it. I was damaged goods. No, I was unlovable. I couldn't have sex with people again without, in theory, putting them at great risk. I know you can relate to that story. I know anyone living with HIV who watches this can relate to that story. But this messaging kind of is the keys to those handcuffs and setting people free. Not to be promiscuous or to, to engage in high-risk activity, but more importantly, to be empowered to take their lives back, isn't it?
Absolutely, absolutely. I mean, I've been places where people will point to their babies and say, this is because of U equals U, or show me their engagement rings and say, this is because of U equals U. There's activists who hadn't had sex in 15 years, 20 years, because they were concerned about transmitting HIV, and they're having sex lives and intimacy they never thought would be possible. So I love the way that you say that about taking the handcuffs off. And I felt that way too. It's amazing to be intimate and not be afraid. HIV had always been present in those intimate moments of, at least of my life and so many people's lives. This fear,
Yeah, and beyond the intimacy, behind the closed doors, if you will, even just allowing yourself as a human being to feel that you're worthy of what every other living creature on the planet wants, which is love and affection, right?
Absolutely. And I think it's important that, no one living with HIV is a danger. Everyone living with HIV is deserving of love and can have healthy and happy and safer sex lives. There's still condoms, and in some parts of the world there's PrEP, so that if someone at any viral load can have sex and still feel safe. We know now that an undetectable viral load is the safest way to prevent HIV, and we have to have no concern. But there really are still ways to reduce that risk and ensure that all of us can have healthy sex lives.
So looking forward, Bruce, the messaging, as you said, and I said at the top, you have been tirelessly circumnavigating the world around and around. I get dizzy with your travels. But where do we go to next with U equals U? And in particular here in the United States, where we still face criminalization laws and things like that. How does U equals U evolve, and how do we keep it moving forward and changing in the right direction for everyone?
Okay, so on globally and in the United States, there are similar things that we need to do. We need to use U equals U in our advocacy for treatment and access to treatment and services and care. As I was saying earlier, we need to go to Capitol Hill armed with, look, if you want to end the epidemic, you'll invest in the well-being of people living with HIV. Because if you get us healthy and undetectable, we won't transmit HIV. So we're going to see policy changes. We're going to see more people living with HIV get the services that they need to thrive and to live. And so, but we've got to get our advocates trained in the United States to do that. We can't keep going to policymakers with the argument, for my well-being, because they don't, are the policymakers caring about that? So that's what we need to do in the United States. Is I'm very concerned about the 450,000 people living with HIV who are not getting the care and the treatment they need, and they're slowly declining in health to stage 3, to late diagnosis, and they're also able to transmit HIV, and that's not acceptable. That almost half the people in the United States are not in care. The United States is the worst of any other comparable high-income country, and as bad as some lower middle-income countries. So we've got to use U equals U in our advocacy for those folks who do not have treatment and care and services. And that's the same thing around the world. Like, I just came back from Japan, where we're working on getting the policy changed where funding or the government only provides treatment to people living with HIV whose CD4 count has dropped below 500. So you have people, and I met them, who are saying, I wish I could get to 500. So in a sense, I wish my health would decline enough so that I could get treatment and that I could benefit from U equals U. A man cried telling me about this. And so we're going to be pushing the health ministry in Japan and working with researchers to say, look, this outdated policy is not good. It's not good for people with HIV from a personal health perspective and from a public health perspective. It's not a good idea. To end the epidemic, you've got to make sure everybody has access to treatment and care and services.
Yeah, and when we say in the epidemic and we say everybody has access to treatment and services, it's also for everybody to start talking about HIV in a way that is not filled with fear and terror. And certainly messaging like U equals U is helping change that conversation right down at the grassroots, mum and pop around the table level. So Bruce Richmond, thank you so much for taking the time out of your incredible busy schedule to talk to us all about U equals U, undetectable equals untransmittable. Thank you on a personal level, because in many, many ways, you have helped give me my life back, and not just me, but millions and millions of people around the world. So please, please keep on doing it, and I will keep doing whatever I can as well. That's going to do it for this episode of Plus Talk. Now, remember, you can follow Plus Life Media across all social media platforms. We are at Plus Life Media, or check us out online at pluslifemedia.com. I'll see you next time.